Good afternoon, all. We are getting ready to step into our next session, which is an exciting one. We've talked about vaccines hesitancies, and all kinds of things great surrounding immunizations and such. Our next session and next panel will be really focused on the registration of the information, where we're able to put that information, our immunization registries, and how we're functionally using those. I am waiting for my panelists to step on, and then I will do a brief introduction, and then we will move forward. This is a great conference. It's so spot on for where we are today. I've learned so much in the past day and a half that I'll be able to use. I am a third generation pharmacist. Practicing pharmacy in Pikeville, Kentucky, so rural Eastern Kentucky. I am presently the chairman of the Kentucky Pharmacists Association, and this next topic is near and dear to my heart, as I have worked directly or indirectly with not only the Kentucky Health Information Network, but the Kentucky Immunization Registry over the past 5 to 7 years, and know the importance of what we're going to talk about today. We're waiting for one more panelist to come on, and then we'll be ready to go. Oh, I see Dr. Nota. I see Rebecca. Welcome. And here's Mr. Andrew. Okay. Well, welcome. I'm going to do a little brief introduction, and then I'm going to turn it over to Andrew, who is going to make a presentation. And then his schedule won't permit him to stay around for questions and such. And so he'll depart after he gives us some great information. And then we'll go to Ms. Coyle and then Dr. Nota in that order. So welcome. Andrew Bledsoe has 17 years of experience in healthcare, with the past 10 focused on health information technology. He began his career at St. Clair Regional Medical Center, obtaining insight in rural medicine for both hospitals and ambulatory providers. Leveraging his rural experience, Andrew moved to Northeast Kentucky Regional Health Information Organization, serving as the network director initially, later moving to the role of executive director. Andrew's current position is the deputy executive director for the Cabinet for Health and Family Services, Office of Data and Analytics, where he oversees the strategic planning and daily operations for the Kentucky Health Information Exchange, which most of us in here in Kentucky just call KHI. Andrew is a graduate of Morehead State University with an MBA in business management, and in his spare time is an apprentice baker, which we will not sadly be able to get into today. However, I would love to have some samples, maybe. I'll go ahead and turn it over to you, Andrew, and then when you finish up, then I'll introduce Rebecca and with her credentials and such.
Okay, thank you so much. And I forgot half of the stuff that was on that bio, especially the apprentice baker. So thank you for that. Let me know when you can see my screen.
Appears to be ready to go.
Wonderful. Thank you. Okay. Thank you for the introduction. My component today is I'm here to talk to you about how the Cabinet for Health and Family Services facilitates immunization data reporting utilizing the Kentucky Health Information Exchange. And so first, I want to lay a little bit of a baseline and an explanation for what the Kentucky Health Information Exchange is and how we're positioned inside of the cabinet. So we are a project, or really a program, that is owned and operated by the Cabinet for Health and Family Services, a health information exchange. And what we seek to do here at the Kentucky Health Information Exchange at the core is simply to exchange electronic health information from one healthcare entity to another. Now that can be from doctor's office to hospital, from hospital to hospital, from a healthcare facility to the Kentucky Department for Public Health or the CDC, really any healthcare entity that is able to have access to electronic protected health information. Our goal is to help to facilitate that exchange of information. And so we are a little unique in our setup because we are positioned inside of state government within the Cabinet for Health and Family Services. It gives us a lot of unique opportunities and benefits to be able to provide services to sister agencies and other departments across the cabinet. And so we are the state designated health information exchange and serve as that data intermediary between the healthcare entities. Now, we exchange quite a few different types of electronic protected health information. Patient demographics, such as name, phone number, date of birth, information about a clinical encounter through demographics, such as clinician information, diagnosis codes. We also exchange lab information, pathology report, transcribed notes, summary of care data, ADTs, if anyone on here is technical and understands that word, behavioral health data. We have a lot of information that we exchange within KHI. We have 8,000 live data feeds representing over 2,000 physical locations across the state. And on average, we exchange 20 million messages within 1 month. So we are a very large HIE, especially compared to other HIEs around the nation. Now, one of the more critical components that we serve is facilitating the public health reporting of electronic health information. And this is where we get into facilitating the exchange of public health data, such as in the box immunization information. So let's jump over and talk about the Kentucky Immunization Registry. So whereas the Kentucky Health Information Exchange is a project inside of the Office of Health Data and Analytics, whose responsibility is to facilitate this program, the Kentucky Immunization Registry is a technology platform overseen by the Immunization Branch within the Division of Epidemiology and Health Planning in the Department for Public Health within the Cabinet for Health and Family Services. So the Immunization Registry is, again, that platform that is owned and facilitated by the Department for Public Health in a separate department within the cabinet from the Office of Health Data and Analytics. And what the Immunization Registry is it's a web-based statewide system that is collecting information on vaccines. And so it serves as a single accurate record of immunizations for an individual. So it collects that information, it develops that single record, and then makes it available externally for agencies who need that information as well. We do have multiple agencies who are reporting into the Immunization Registry: clinics, pharmacies, a significant amount of pharmacies, home health agencies, hospitals, mobile clinics, long-term care clinics, anyone really who is providing an immunization. Any type of agency is likely reporting into the Immunization Registry. So I delineate specifically between the Kentucky Health Information Exchange and the Kentucky Immunization Registry because they are two separate programs facilitated by two separate offices and departments within the Cabinet for Health and Family Services. I know that is very commonly misunderstood or maybe misrepresented. And I know, honestly, prior to coming to the cabinet, I did not have a detailed understanding of how those two programs operated separately, but also collaborate significantly to increase the ability to report vaccine information electronically. So let's talk about that for just a second. So that's how KHI comes in and collaborates with the Kentucky Immunization Registry program. We are positioned to facilitate that electronic reporting of immunization data into the Immunization Registry. Again, two separate programs, but we're working very collaboratively to help make reporting this information as efficient as possible. So kind of the walkthrough of how this works is if you are, let's say you are administering a shingles vaccine, you enter that into your computer system that you have within your facility. Maybe you're a doctor's office and you have an EHR system, or maybe you are a pharmacy and you have an electronic program. You input into that electronic program that you have administered that vaccine. At that point is when KHI picks up that information and we report that directly into the Immunization Registry. And that's all that has to be done. This really is a significant decrease in the burden for reporting to the Immunization Registry program because it is automatic, fully electronic in real time. All that you have to do is log in the appropriate place in your technology system that you've administered that vaccine, and then it can be translated over automatically. And so that is one significant component of what we are doing here by submitting the immunization data into the Immunization Registry to make it as robust as possible. Another additional benefit and service that we offer is we can help to facilitate a query of immunization information logged in the registry. So back to that kind of perspective of you are a provider in a clinic, maybe, or you are you're a pharmacist at a pharmacy, and you are working with a patient and they can't remember if they've had that shingles vaccine. The technology systems, the EHRs, the systems used in the pharmacies have the ability to do a query through KHI that asks the registry, hey, I'm working with John Smith here. Tell me what immunizations he has available in the registry. That information can come from the registry back through KHI and be populated inside of that system. Again, keeping all of the work as efficient as possible and not requiring individuals to log into multiple systems, to do multiple requests of information, but really streamlining this process utilizing technology. So this is kind of how we collaborate and how we work together to make this as efficient as possible. I will report, I think I'll go ahead and talk about it on this slide. We do have over 3,000, just under 3,100 locations who are contributing immunizations electronically through KHI into the Immunization Registry. I think that's actually reflected on this slide here. Yeah, just over 3,000 organizations are electronically contributing this information, again, making a very intuitive workflow process for reporting immunizations into the registry. You can see so far in 2021, we have transmitted over 7.5 million immunization messages into the registry. That is not just COVID, that's above COVID, that's all immunizations. And also we have performed 13 million queries. That's where you're requesting within your technology system information on a particular patient. And you can also see here from this graph how that has grown, the queries and the capabilities throughout the course of this year. And you can kind of track how those immunizations have been reported throughout this year as well. A few more statistics on information. We have, over the course of as long as the COVID vaccine has been available, we have transmitted over 2 million of those electronically into the registry. And so a fairly significant portion of those COVID vaccines that are being logged in the Immunization Registry comes through KHI. There is still the ability to manually enter information into the Immunization Registry. This electronic is really just an option, but it is really a what I would classify as a no-brainer option because it, again, streamlines and automates the entire process. Manual entry would require individuals to log into the Immunization Registry to manually input that information. Sometimes in the absence of an electronic connection, that is required, but does require that additional work, but does still allow us to work to make the Immunization Registry as comprehensive as possible. Another little side note there, another process that we facilitate is lab test results reporting into NEDS, a little bit separate, but since we're talking about COVID, throwing this in here that we have additionally transmitted over 4.5 million COVID lab test results into the state's disease surveillance systems, making that directly available to the local health departments as well as the Department for Public Health, again, eliminating redundant data entry. And so really, what does this do? By having these programs, the Health Information Exchange, the Immunization Registry, two separate programs working very collaboratively, what occurs, what's the benefit of this is we facilitate access to accurate patient information. So by eliminating multiple points of data having to be manually entered, we are helping to ensure the accuracy of that information. We can communicate directly with the disease systems that's utilized across the state, other KHI platforms, other technology systems within the cabinets, and directly to the CDC to facilitate reporting. And we do follow those CDC directives and abide by our recommendations for reporting. We can also pull demographic data on immunization rates. All of the immunization reports that you're seeing, much of that is coming from the Immunization Registry. We can help to increase the immunization coverage because we can map where immunizations are being administered, where they're not being administered. We've been using this to track COVID-19 vaccination rates and then sharing data where appropriate with adjoining states and other state agencies inside of the state of Kentucky. And so I apologize that I'm unable to stick around for the question and answer, but if you would please visit our website, and here's some of our contact information. If you'd like to contact us directly, if you're interested in getting set up with this electronic connection, or you'd like to know more information, please feel free to reach out to us at any time.
Well, Andrew, I want to thank you for joining us and for your presentation. It was full of information that I have used and known for years as a practicing pharmacist, but the work that you all do continues to excel, especially during this pandemic and all this other immunization work that we try to conquer on a daily basis to make sure all our children and adults are at least up to date. So again, thank you for your time and for your presentation.
Thank you.
Next up, we have Ms. Rebecca Coyle, who is the Executive Director of the American Immunization Registry Association. She oversees the development and promotion of tools and best practices to support the implementation of immunization information systems as an essential tool in preventing and controlling vaccine-preventable diseases. Rebecca has a master's degree in education with an emphasis in public health. She began her work in the immunization community in 2002 as the school and child care coordinator for the Idaho Immunization Program. She worked in the Minnesota Department of Health as the Center for Disease Control and Prevention Public Health Advisor before returning to Idaho as the Immunization Program Manager. Rebecca joined the American Association in 2010 as its Executive Director. Welcome and thank you.
Well, and thank you all so much for having me. This has really been a sort of a treat to sort of step out of some of the, above the sky, pie in the sky, big picture, and really kind of zero in on some of the local challenges that I think are always sort of fun to come back to. So I appreciate the opportunity to talk a little bit more about immunization registries. I think Andrew did an amazing job of sort of teeing up exactly what Kentucky's immunization registry looks like. And what I'd like to do is sort of take that to the next level and talk a little bit more about sort of the overarching role and goals for immunization registries. Before I jump into that, I just want to note, so the American Immunization Registry Association is our member organization that really serves to represent all of the immunization programs that are operating immunization registries out there. And what we do within this organization is we really try and develop some of the standards and best practices, and then also look, very strategically about how we can engage and sort of highlight the role and value of immunization information systems. So with that, I'm just going to go over some of our goals for today. So I want to review the history and purpose of IIS, review the technical considerations. I'm going to describe the key elements and functionality of successful IIS. The policies and the impacts that they can have on IIS and their functionality. Some of the technical considerations, I realize that probably not many of you are all that technical, but I'll talk very high level about what that might be. And then just some considerations for some of the future portions related to IIS. So with that, let's talk about the history and purpose. So at the very high level, this is sort of our dictionary definition of what an IIS is. I actually think I like Kentucky's example of their description of the immunization registry, and I'd love to borrow some of those elements for the revisions. But at the sort of concept level, what these systems really serve to do is to provide that consolidated immunization record for an individual. They are also a tool for public health to be able to leverage that for coverage rate assessments, to identify pockets of need. They have been long used in schools across the US to be able to identify students that are up to date, who are missing immunizations. But I think we've seen a lot of utility, and they certainly have sort of flooded the national scene with COVID. And this is for the first time ever, all of the immunizations for COVID only have been reported to an immunization information system across the US. And in turn, that information has been sent up to the national level. So whether you know it or not, all of the IIS data or any of the data out there on COVID vaccination coverage rates at the high level is pulling information from all of the IISs across the US. So it's very cool. So where do all of these systems exist? So they are in all of our states now. We had our final state go live a little bit earlier in this year. What a horrible time to try and onboard everybody and get everybody up to speed, but we're thrilled to have New Hampshire up and running. And then we also have IIS that are in some of our larger cities like New York City, Philadelphia. And then we have some of the counties. So San Diego and San Joaquin in California still operate an immunization registry there. And outside of the US, and well, I shouldn't say outside of, we have our freely associated states, and then all of the US territories operate a system. So it's rather broad. It really covers all of the US population at this point. So in terms of data capture, this is often a question we get is, how populated are these systems? So on your screen, you can see sort of what the data capture across all of the IIS look like. And just so you know, this is 2019 information. This is pre-COVID. You'll notice in the far right where I've displayed some of the adult information, I think it's key to note that this is all pre-COVID. If you think about the pandemic efforts and the vaccination efforts that have taken place over the last 9 months, a lot of this is really targeting the adult population. And we expect that this will jump significantly when we start looking at data being reported from this year. I also just wanted to highlight where Kentucky sits in context to the national picture. And by and large, Kentucky is not too far off of where the rest of the country is. And again, this is a couple years older. For those of you that may not know, Kentucky, when they stood up the existing IIS that they have now, and I should say the service platform, they sort of had to stop some of the data that was coming into it and clean it. And there's a lot of things that go into it. So for a while, there was a lag in, I think, some of the data that was in the system. But I am so excited to see that it continues to go up every year. So some of the policies, this is both the big P, so those laws, and then also some of those little Ps that might be implemented at the state or county or even at the clinic level can impact sort of how the IIS functions. So first of all are those authorized users. So there may be local law or policy as to who can access the information, who can contribute information. And that exists not just for medical providers or persons providing immunizations, but it can also extend down to the consumer or the individual that may have been vaccinated. And they may or may not be able to access their immunization record through the IIS, depending upon how the laws are set up. As far as consent, and this is typically what we talk about when we talk about consent, is either an opt-in, meaning that you have to explicitly consent to go into a system, or opt-out, meaning that you automatically go in and then you have to ask to be excluded. And some states don't actually allow for opt-out. It's just you're in and you're in. But that's fewer. Most states have an opt-out policy, meaning data goes in until you ask for it to be removed. Mandates to report are a huge issue. As I noted, for the first time ever, we have a reporting requirement for COVID, and it is mandatory for all providers. It's part of the provider enrollment agreement, and it's probably the single reason why we have such great data on all of the COVID vaccines that are out there. I mean, at a glance, we sort of know what's happening almost minute by minute, but truly at the national level, we know day by day what's happening out there. That mandate does not extend to other vaccines, and so it is up to each jurisdiction to determine which providers must report. Some have taken the approach of only certain providers have to approach or have to submit. Others have mandated that certain populations, so for example, an age range of like 0 through 18 must be reported to the Immunization Registry, but adults are optional. So there's sort of a hodgepodge of policies out there, and all of this sort of shows up when you look at the participation rates. A lot of folks don't want to add on any additional work or any additional effort, so if it's not required, it may not happen. I think it's also important to note, and I think Andrew did a really nice job of calling out sort of the program components and how the immunization information system really exists to support the immunization program for the jurisdiction. And there are certain priorities and activities that a state may want to undertake, and you'll often see that reflected in how the systems function. So for example, Washington State has a very externally facing campaign for new moms and moms with young children. So they send out public health information across all sorts of topics, but they leverage their IIS in order to identify, who those individuals are and then how they get that information sent out. So we've seen a lot of utility in being able to leverage the information for purposes even outside of immunizations. And then I'll just note the standards, so maturity and standards adoption really play a role in sort of how populated an information system is, and also how high the quality is. So if standards are not implemented, it's sort of a hodgepodge of what exists out there. I'm pleased to say that most states are now adhering to standards, and we have a program within ERA where we actually measure all of the immunization information systems to see sort of where they sit in compliance with some of those standards. So I want to just note provider participation. I think this has always been an issue. It continues to be an issue. And I put this scene up there, what comes first, the chicken or the egg? I think it really applies to this situation. A lot of providers are not necessarily wanting to invest a lot of time and effort into a system that they don't know is going to have high value or return for them. And so the issue with that is that if they don't contribute to the IIS, then the data is not there down the road. And so as other providers are trying to decide, do we actually submit to the Immunization Registry? Do we pull it down? My patients aren't in there yet. It's one of those where we have to sort of take a line and we have to say, okay, we all need to be contributing information to the system about our patients and about our practice so that information is there down the road. And so it's that initial first step of getting folks to start sharing that information that is often the biggest hurdle. Once the information is in the system, providers often find this to be a tremendous utility to their practice, particularly related to COVID. You can see, what your patient may have seen. They may say they got Pfizer, but really they got Moderna. And if you're thinking about, do they need a booster dose or, what do they need? You're able to look at that information. So I think we're starting to see some of this dissipate, but it continues to be an issue. All right, I'll talk quickly about some of the technical considerations. I think it's important to note where IIS data comes from. So at the sort of 30,000 foot view across the board, these are the primary data sources that feed information into an IIS. So most states, with the exception of I think 2 or 3, are getting a vital records feed. So vital records sends all of the birth information into the IIS, typically on a either monthly basis or weekly basis, depending upon how that is structured. And then another key piece with vital records is that we also need the death information as well. And what that does is it helps inactivate those records so that folks don't get reminders, that we can really have a true and accurate picture of what the population looks like. Direct data entry is really pulling up a browser. It is logging into the system and it is searching for your patient and then adding new vaccines. The electronic health records systems, or EHRs, has been a huge area of interoperability. Over the last 10 years, we've seen this grow tremendously. And pre-COVID, about 80% of all data flowing in was flowing in through electronic data exchange. And I should note that the electronic data exchange is not just limited to EHRs. It often includes pharmacy systems and some of the other systems as well. But it's that electronic component, that it's not hand data entered, is really a key piece. Pharmacies, I think it's been noted that pharmacies have played a huge role in, I think, the COVID vaccine rollout, but also across the board, they've played a larger role in the overall landscape of immunizations, particularly related to adult care. And we are so thrilled that more and more pharmacies are joining in and submitting data. And then there are other systems as well. So an example of another system might be a payer. It could also be a daycare situation. And I don't pretend to know exactly what the policies are within Kentucky, but there are a variety of different other systems that might be contributing. Long-term care facilities, skilled nursing facilities, those are some examples. So stepping back in time to 2019, there were about 117,000 live data exchange connections across the US. We also anticipate that this number will go up significantly, just recognizing how many new providers are actually submitting data to IIS. Standards. I think the key piece here is that I don't want to pretend that you all are going to understand all of this, but really what this means is, at the highest level, when standards are implemented, it means that all of the systems are adhering to best practices and are implementing these in a standardized format. And what that means to you as a provider or somebody that is using the system is that the information in there can be of the highest quality, and it sort of guarantees that it is operating according to the way that it should. I'm going to sort of skip over this next one a little bit. I think this is just the triangle of dilemmas, for data quality. There's always the issue of timeliness, accuracy, or incompleteness. If you sacrifice one, you often gain in other areas, and vice versa. So this continues to, I think, plague immunization programs and providers across the country. If you want to go fast, you have to sacrifice something. Often it's data quality that is what gets sacrificed. So I want to just talk very briefly about some of the future considerations. And I think Andrew shared sort of the Kentucky viewpoint, but this is just a snapshot of growth in volume on a daily basis. And this is one state, this is not Kentucky, but pre-COVID, there were about 17,000 daily submissions. And you can see the green are all of the COVID vaccines that were submitted just in one day. And that was this past April. And that blue bar at the top are all of the routine immunizations. So all of the non-COVID immunizations that were being reported in a single day. Obviously, this is an exception, and hopefully we don't go back to a period of time where we're having to administer this many doses in any one day. But this is an example of what that can look like. I also want to just note the evolution of vaccine records and patient access to the records. So I will just say for the record, I loathe the term vaccine passports. If we could go back in time and scrub that word out of everyone's vocabulary, I'd be more than happy to do so. I think what we really need to focus on is the issue of people having access to their immunization records, and in a way that I think the population has sort of moved into a digital era. So if you look sort of on the screen, if you think about the yellow card that probably many of you received as a child, and maybe you still have it and carry it with you, we also now have the COVID-19 vaccination record card that I think is what a lot of folks are holding on to. But there's also patient portals. So if you have like a Cerner product or an Epic product for an electronic health record system, you know that they all have a patient portal, and you can go in and pull down your immunizations, and you can take a screenshot or you can view it right from your mobile device. What we're now talking about is making that a little bit more portable. And so you can see on the right-hand side, there's that QR code. And this is really a way to take the information that has been on paper forever, and we're going to move that into the digital space and do that in a way that both ensures equity to these immunization records, but then also protects and keeps this information confidential. So in some ways, that QR code actually, I think, makes things a little more secure than certainly what is on the yellow card or the white card that we have. And I just want to underscore that it is important to note that just because a digital record or a QR code can be generated does not mean that any health agency or entity is enforcing how these ought to be used or mandating how these ought to be used. This is strictly taking paper records and moving it into a digital format. And we saw that happen with mail. If you think about all the mail and all the junk mail you used to get, and now how all of that is all going to your email inbox, this is really sort of that same concept. We want to replicate how a person accesses their information, where they access it, and be able to put that into a digital format. And I'll just note there are some big, so if you're not familiar with the Smart Health Card technology, it's part of a vaccine credentialing initiative that is a very large coalition of both public and private partners across the US that have really been working behind the scenes to try and create a standard for how to issue these QR codes that can be done by any EHR, by any pharmacy system, by an immunization information system. Those are starting to roll out now, and if you have access to like MyChart or and I say MyChart because that's what I have for my own provider. You can actually go in now and you can download your own QR code, not just for immunizations, or I should say just for COVID right now, but it can extend to other immunizations, but also for any lab reports as well. All right, and I know I'm at time here, so I'm going to just quickly note, I think some of the future considerations are state and national policies and how they evolve to meet sort of the new users and the new landscape, but also recognizing that there's a need to share information more broadly. We also need to really, I think, confront our sort of aging technology and the need to modernize our systems so that we are more agile and can meet the needs of emerging pandemics or other situations. And that's not new. It's just something we need to, I think, start tackling. And then providers reporting all vaccines administered. I would love to see something happen across the board where we just commit to all providers reporting all immunizations to IAS. That's truly what's going to get these systems populated and make them the most useful for all providers out there. And then lastly, this is it's not new to public health, but certainly the issue of sustainable funding. How do we continue to carry on when this wave of funding that's currently available for public health sort of subsides and we're left with very small budgets. So with that, I'll just say thank you, and I look forward to hearing from the rest of the panelists and your questions.
Thank you very much, Rebecca. That was awesome and very insightful. I do appreciate your time. And then we might have a question or two here at the end after we get through Dr. Nota's presentation. So thank you very much. As most of you, well, some of you know, because I do have friends out there in the world, I tend to associate myself around pediatricians. And if you were on here last night, you were here with one of my close friends, Dr. Rakesh Sachdeva, who's the pediatrician who I work in the clinic with. So I get another pediatrician today, Dr. Nota, from the other side of the state. So welcome, Doctor. Dr. Nota is a pediatrician with Norton Healthcare. She received her medical degree from the University of Tucumán, Argentina, where she is originally from. She completed the pediatric residency program at the University of Louisville and the leadership fellowship with the National Hispanic Medical Association. Dr. Nota is a former associate professor with U of L Department of Pediatrics, currently serving as gratis faculty. Dr. Nota sees patients at the Norton Children Medical Group in the Germantown office and was named Director of Community Outreach for Norton Healthcare. Dr. Nota has a strong commitment to the needs of the Latinx community, particularly children with special medical needs. She co-chairs the Immigrant Children Health Task Force of the Kentucky chapter of the American Academy of Pediatrics and the Immunizations Advocacy Committee of the Metro Louisville Board of Health. Dr. Nota was awarded the AAP Kentucky chapter Don Chantley Community Service Award in 2015 and the Kosare Charities Roger Fox Award in 2018. It is with my pleasure that I now turn the floor over to you, Doctor.
Thank you very much for this opportunity to talk in this very important forum. Let me see if I can share my PowerPoint with you. Can you see it? Mm-hmm. Okay, so can you see my presentation?
Yes, ma'am.
Excellent. So I want to share with you my experience as a pediatrician who works in an office that uses the Kentucky Registry. I want to just share that I wanted you to see the other side of the coin. As it was mentioned before, the Kentucky Registry houses the immunization data of Kentucky residents, and it collects the information from hospitals, pharmacies, health departments, and clinics across the state. It's very easy to get access to the registry through the website interface. And if the electronic medical record is enrolled with the registry, that information will transfer to the registry without a manual entry. So it provides free access to statewide immunization information. It provides information for research, including the COVID-19 vaccines, and allows providers to run a recall report on patients who are coming so we know who is due for what vaccine. And it also provides the coverage rate report that will allow us to know which areas of the states are in need of vaccination to better protect our patients. Those is kind of the benefits. Providers administrating immunizations, there is a minimal information that needs to be entered in the registry. So in some offices, the medical assistant will do it, or the LPNs. So whoever has access to the registry in the office and provides vaccines will need to enter all this information. The date of the administration, the vaccine name, the vaccine manufacturer, the lot number, the name and the type of the person giving the vaccine, the name and location, the address where the medical record receipts, and the information on the vaccine information statement. Those are the minimum requirements to get the vaccine entered in the registry. So, but I wanted more than talking about the benefits that I believe nobody has any questions about that, is the challenges that we face as a primary care, as a pediatricians or primary care providers using the registry in a everyday basis. So I will present these challenges in a case format. I will share with you 3 cases that are very common in our office. I want to clarify that our office serves a very diverse population. We provide vaccine for children, and we also provide commercial vaccines. We have a large immigrant population, patient in our office, being Hispanic at the top. So my first case is a pediatric patient whose family moved from Chicago to Kentucky. This patient is in the clinic to establish care. The mother brings an Illinois immunization certificate. She reports that the child is up to date with the shots, and she just needs a Kentucky immunization certificate for her child to start school. So, who in the office will review the Illinois certificate? Who will enter that Illinois vaccination data into the Kentucky registry? Would it possible to give the Kentucky immunization certificate to this mom today? It really depends. If your office is short in staff, if you're running late, if you're behind seeing patients, this evaluating an out-of-the-state certificate takes time. You have to check if all the shots have been given in the correct interval. Based on the age of the child, you have to check if the child is really up to date, as his or her mother said. If you have the manpower and the time to do it, then you will be able to provide this man with a certificate in the same day. But if you are behind, you are short in staff, you may not be able to do it. Sometimes we tell the parents, I'm sorry, I cannot review all this today. You will need to come back another day if your child is behind in shots. Or if the child is up to date with the shots, we will send you the Kentucky immunization certificate by mail, so you will have it. So as you can see, a lot of time and manpower that needs to be allocated for this child that just moved out of from another state to Kentucky. Second case, a child comes to the office with a foster parent. The foster parent has had this child only for 1 week and has no medical or vaccine records. An immunization records is needed for the child to start daycare and for the foster parent to go back to work. You or your assistant log in the Kentucky registry hoping that the information will be there. And guess what? Nothing is there. So why we don't have this information on this child who is in Kentucky on our foster care system? It could be the child that never got the vaccines. It could be the child that got the vaccines in a practice that do not use the Kentucky Registry. So what we will do next? Do we start over? Well, my next would be to ask the foster parent if is there any way that this parent can get vaccine records. And if the parent goes, there is no way I can get the vaccine records, no, in the next week, I need to go back to work on Monday, this child needs to be in the daycare, so I need the Kentucky record now. So what we do, sometimes we have to start the series over. And if this is a child who is a 4-year-old or is an 11-year-old, you just can imagine the numbers of shots that the child will need. These shots, these vaccines will come from Vaccine for Children. So just guess the cost of duplicating vaccination in a child that we do not have records. Then the third case, a child whose family just moved from Mexico 6 months ago, is in the office, and the child needs the school physical and the immunization certificate to attend 6th grade. The parents brings a vaccine record that looks like this. So first thing, no English. This is Spanish. Then you can guess some of this information. You can see here BCG for tuberculosis, hepatitis B for hepatitis B, DPT. You here, if you can see well, it's a diphtheria, and it's saying in Spanish, tos ferina. What is tos ferina? Tos ferina is pertussis. Then you can see polio, the DPT is not difficult to figure out, rotavirus, and then here you see pneumococcal conjugada. What is that? That is the pneumococcal vaccine. Then we were lucky in this record to have these stamps with a date. So you can see 4 September 2019, then 5 November 2019. What is this ENE? That is January. So you need to translate this to English. Then most of the months are not difficult to figure out. But if we get a record like this, that do not have all these stamps, and instead of this, we get numbers that happen often with our immigrant children's records. And instead of saying 4 September, you get 4/9/19. Is that the 4th of September or is the 9th of April? So I just want to clarify that in other countries, the first number is the day and the second number is the month. So if you only get numbers here, you have to figure out if we're talking about months, dates, is this 4th of September or is 9th of April? So that is a big challenge when we get these records. Here in the second page, you can see for pneumococcal vaccine, you can see here November 5th, and then January, and there is 2 very faint that you can guess that it says September or March, no year. So this child got 2 pneumococcal vaccines or got a 4. And then there is a 2020 here. So you just can imagine. And in this record, there is no hepatitis A anywhere there. The child got it and it was not documented, never got it. So in this case, what you will do next? Who reviewed this foreign immunization certificate? Translate it into English. Are these vaccines in accordance with our recommended vaccine in the United States? Are the interval between doses correct? And then after you figure out all that, who will enter this historic data into the registry? So you can imagine the time that you will need to invest on each one of these patients. Who will do it? Your medical assistant? Do you have enough staff to go over this? So these three cases represent the most common challenges that we see in our office. Kentuckian children's in foster care programs, children that come from out of the state, immigrant children, and even patients, new patients who come from practices that do not use the registry. Then finally, I just want to come up and share with you a few recommendations that I put together with some help from our Metro Louisville Department of Health. I am just a primary care provider, a pediatrician. I'm not a policymaker, and this is just my recommendations on how we can improve our registry. So the first thing I would suggest would be to create a task force that include pharmacists, pediatricians, adult vaccine providers, school nurses, K-High staff, and some other people who will review and examine the regulations, the necessary administrative regulations that we need to make changes. Then I will suggest that we identify practices and pharmacies within the state that are not using the Kentucky registry. Why they are not using it? What are the barriers? How we can come up with a solution to overcome those barriers. Then technology today can do almost everything. So reducing the burden of manual entry will be a great help, because as it was said before, if my EHR, my electronic medical record, when I enter the vaccines there, that information is transferred to the Kentucky registry, it's not happening the other way around. So when we log in the Kentucky registry, we can see everything that the child has had there, but we had to print that information and manually enter in our electronic medical record. So if my EHR can talk to the registry, why the registry cannot talk to my EHR? So I think that would be a very simple, easy, simple thing to fix with technology. So we kind of reduce the burden of, especially for the historical data. And then finally, as everything, we need to allocate funding. Every presentation I hear today, it was said today that we, primary care, pediatricians, adult providers, we are the front line on this. So we wanted to increase the rate of vaccination in our children and our adults in Kentucky, but we cannot do this alone. So if the government can allocate funding, grants to providers to cover the cost to implement and maintain the registry, that would be another big push to get finally everybody on board. And my final message as a pediatrician is that I feel that this is a precious time and it's the right time to improve our Kentucky Immunization Registry. We can do it, but we had to do it together. Supporting pediatricians and working with the government, providing funding and the resources that we need for this to happen. And only then we will be able to increase our vaccination rate in our state.
Well, thank you, Doctor. That was an excellent presentation, and my heart does go out to you and all the primary care providers out there, because those three cases were spot on with some of the nightmares that I could just imagine or see every day, especially as we have gone and moved the requirement to have a KYIR certified document for our school-age children and children in certain areas. So thank you very much. Rebecca, I do have a question for you. As you've been in this position now a little over a decade, and it goes to the good doctor's presentation, how are we seeing the budgetary requirements or budgetary issues change statewide around the country?
Yeah, it's a great question. So it's always feast and famine, I think, in public health. You know, as soon as there's a problem, we throw money at the problem and we expect it to be solved overnight. So I got into immunizations on the wave of 9/11. So big influx of funds for public health. And then you've sort of seen registries rise to meet that occasion. So in 2009-10 is when Meaningful Use rolled out, and it was an incentive program to encourage providers to adopt electronic health record systems. And what we have seen in the last 10 years is that broad adoption. So being able to connect to immunization registries is one of those core components in the public health category. So we saw all of that rise up tremendously. And I think the sort of the next wave that we're seeing right now is related to COVID. And we're seeing some of the funds come into public health. I should note, for Meaningful Use, providers were incented, but public health never received any dollars to onboard all of the additional providers. And then there's still a gap, I think, in providing funds for pharmacies to be able to onboard their systems to an immunization registry. So there's still, I think, a significant need out there to provide resources to pharmacies, to smaller providers and practices that don't have the capabilities. And I will also say there are some funds available, but how that's rolling out is really up to each jurisdiction.
Okay, thank you. I have a question on here, and I'm not quite sure how. I'm not sure this answer here in Kentucky, but how does a patient actually access, if they want to access their immunization records online? Could that be done?
Yeah, it's done through the parent portal. So in Norton, we use Epic, and Epic provides My Chart. And the parents get access to their children's chart, and they can go to under immunization and pull all the data, all the reports on the vaccines.
Okay.
I just want to add one piece to that, because I think this is brand new as of Thursday last week. So Epic enabled the ability through My Chart. So if you have that app, you can now query the immunization registry to check for immunizations. And keep in mind, this is just COVID vaccines now, but the goal is to kind of look at this more broadly in terms of all vaccines. So this is the first time using sort of a third-party MyChart to query an immunization registry on a broad scale across the US. There are a number of states that have also enabled consumer access directly to the immunization registry. So there's a number of other platforms and ways to access that information.
How much has this changed the tool of an immunization registry, changed the landscape of youth vaccinations, or you know, we talked about with COVID in a year ago that we have a big void there of about 6 to 8 months, when, or really probably a little larger than that, when we had no in-office visits and we were missing that void. How will we be able to use the immunization registry to that tool to help bring those back, in your all's mind?
For COVID vaccine, the immunization registry has been very useful for us as providers. When I look in there, I see if my teenager got the COVID vaccine, and if it's there, that's it. I congratulate my teenager for getting the COVID vaccine. But if I see a 12-year-old or older who did not get the vaccine, is when I open the whole conversation. What about the COVID vaccine? Why you didn't get it yet? What about, let's talk about it. And that really opened the door for me to talk to the patient and talk to the parents. And we were able to get parents to get the COVID vaccine because the child wanted. So it's very useful to have that information in the registry.
So in your practice, doctor, you have incorporated not only using the immunization registry as an entry when before the patient comes in, but you're also utilizing it while the patient's there to make sure they are up to date in any vaccinations that are necessary.
Yes, that is correct. In every visit, regardless if it's a checkup visit or a sick visit, we review vaccines. Especially now with flu vaccine, in our practice, we provide flu vaccine and COVID vaccine. And if the child is behind with any vaccine, it doesn't matter the reason of the visit, we offer. If a child comes to see me for eczema and is behind with flu, hey, we're doing flu vaccine today.
Mhm.
What about getting today that you're here? So yes, in every visit, we review the Kentucky Registry and the vaccines records.
Excellent. Well, I want to thank you both for your time and your dedication to not only Immunization Registry, but to the health and welfare of the public. Your all's work is greatly appreciated from a practicing provider out here. So thank you all very much for your time today.
Thank you.
Thanks for having me.
And now I'm going to turn the tables over to our dear Allison with some closing remarks.
Thank you, Joel, and thank you to the you all as panelists. I really feel like this presentation to wrap us up at the end of our Bost Forum provides an opportunity for some potential policy wins around immunizations, especially as that relates to the use and perhaps some assistance to enable more providers to use the Immunization Registry. So thank you all for a much informative panel discussion about Kentucky Immunization Registry.